Okay, so today is Friday, May 3rd, 2024. Um, Dramatic change in events or the course of events for the next week or so. Um, so the majority of my metastatic breast cancer recurrence is in my right hip. And we were scheduled for total hip replacement on May 9th. So next Thursday, just under a week from today. And yesterday I had my MRI. We wanted to do it 3 weeks after I finished radiation. I finished radiation March 22nd, 2024. We wanted to do it 3 weeks after radiation and then surgery 3 weeks after that. So a total of 6 weeks between radiation and surgery with an MRI in the middle. However, they couldn't get me in right away, and so the best they could do was 8:30 last night, which was super weird being in the hospital like after hours. But my fantastic surgeon, my orthopedic surgeon slash orthopedic oncologist, he reviewed the scans today, right before my appointment this morning, and it was like less than 12 hours between from scan to appointment. So he reviewed them, and it was hilarious. He walked into the room and he said, and he's this wonderful, like tall, older South African gentleman, always dressed very dapper. He had like a white linen pants, a white linen or a navy blue linen blazer with like a dress shirt and a bright blue fantastic bow tie. And he walks in, he shakes our hands and stuff, and he says, "What do you want me to do to you?" And I was like, "What do you mean?" And he said, "My scan looked incredible." He didn't say miracle, but he said people either respond or don't respond. He's a surgeon, and people either respond to radiation or they don't. And apparently, I've responded very well. So that is a major win that I needed in the last few weeks. That radiation has essentially killed the active tumor in my hip. I still have a ton of other cancer in my body that will hopefully be treatable with these oral medications. But long story short, we will be postponing surgery. I was scheduled to have a total hip replacement next week. We have postponed surgery for at least another month to 6 weeks. The radiation that I finished on March 22nd has essentially killed the tumor, the active tumor in my right femoral head. The big question was how much of my femur they were going to have to replace with a rod, a prosthesis. So he was planning on using, based on my initial scans, he was planning to have to use the entire, like the biggest prosthesis that they had, which is risky because long bones bear a lot of weight, and I'm young and, wanting to still, relatively young for this disease at least, and for this type of surgery, and wanting to maintain my active lifestyle. So, doing the biggest prosthesis they have is risky for a lot of reasons, and maybe could have limited my mobility in the future as well. So the great news is that it looks like my bone is maybe able to heal a little bit on its own. I'm probably still going to need some sort of stabilization surgery. So like a bone, what do they call it? Like a bone cement type thing, but far less invasive than a total hip replacement. And so that's great news. I have mixed emotions about it though, because, we're still like, I still have extensive disease all across my pelvis. My lumbar spine, thoracic spine, left clavicle, multiple ribs, and calvarium. So like right up here in my skull. It's not in my brain. thankfully. But yeah, in my skull. So it's like kind of tender there. But none of those places are conducive to radiation therapy at this point. So we are relying on systemic therapies, this study drug and this oral targeted chemotherapy, so systemic therapies on top of Lupron, which shuts down my ovaries and prevents estrogen from proliferating my disease. So I still have, I still have a lot ahead of me, but this is a major win in the long run. I have some mixed emotions about not having surgery because I was really looking forward to it as, a great way to, or a great path toward regaining my mobility, which has been such a nightmare on top of just feeling sick, not being able to move, because movement to me is the absolute best medicine. And I haven't been able to do a whole lot, like barely even walk my own dogs. I'm on crutches for like almost 3 months, and it's on my right. And so driving is like, they haven't explicitly said you absolutely must not drive, but they say you don't want to be doing that, which I understand, because if I have to like slam on my brakes, which I live in Denver and it's a shit show here for traffic. So, or, if I get in an accident or anything like that, it's scary because my bones are at higher risk for fracture and it fucking hurts. The pain has gotten a lot better since radiation. I did have a lot of side effects of radiation this time that I didn't have before, which is fair because first time I did radiation was the right, upper quadrant or right upper torso. And this time it's my hip. And so they, got a little bit of my colon, a little bit of my intestines, a little bit of my bladder. And so I had like I had radiation cystitis. Which is essentially like a bladder infection, all the symptoms of a bladder infection, but without the actual infection. So it's just irritation. So like you're peeing blood, it burns. It's just miserable. And I had that for a couple weeks. And then my colon just like decided to not work, which was crazy because they said a lot of times diarrhea is a major side effect of radiation. I had the complete opposite. It was miserable. Plus I was on pain meds. Plus, I guess a lot of metastatic breast cancer patients with the drugs that we take for like targeted therapies cause constipation. They either cause constipation or diarrhea. And so I had the former. And so I was already nauseous from the meds. I was nauseous from the cancer, and I was nauseous from the constipation. I mean, radiation, like, it was a fucking nightmare. I'm not gonna lie. It sucked. But now I'm like, okay, I'm on the other side of it, and I'm starting to heal. I'm starting to feel a little bit better. I was also I'm on day 2 of a break in my chemo drugs because we were going to hold drugs for a week prior to surgery, which would have been yesterday, and a week after surgery, which I was so looking forward to because these drugs have been absolutely miserable. But yeah, so now I'm just gonna slow roll it and message my oncologist after I finish this video to tell her like, hey, I'm not having surgery, so do I have to go back on my drugs, or can I do this 2-week break, or let's just change them? Because I'll be honest, there's no way I can stay on these drugs for the rest of my life, however long that may be. I just can't function. I'm nauseous. I just feel so, I don't want to say despondent, but just, it feels like there's no light at the end of the tunnel when you take these drugs, for me at least. And I really, really understand the argument of quality over quantity in terms of life. quality of life at this point. I can completely understand how people stop treatment, especially in the later stages, and I don't want to be there this early in my first line of treatment. There are multiple lines of treatment that I can try. It's just a delicate balance of figuring out what is actually going to work to, systemically to stop the spread of this disease, if that's even possible. And also to allow me the quality of life to enjoy the quantity of life that these drugs are supposed to give me. And that is a huge disconnect, I think, for a lot of people that don't understand, what it's like to live with something like this every single day. And I didn't. I mean, I went through chemo once before, but there was an end date. There was a bell to ring, at the end of that course of treatment. And there's really not this time. It's the rest of your life. So yeah, I'll have to talk about that too. I'll have to talk about the reality of metastatic breast cancer and the differences between stage 4 breast cancer and stage 4 any other type of cancer, or not any other type of cancer. I hate to use superlatives, but there's a difference. And I can really only speak to my own understanding, my own experience. So that'll be for the future, but the bottom line is no surgery next week. We're going to postpone and see if my femoral head, neck, and long bone can kind of heal themselves a little bit. And yeah, I remain on crutches, which sucks, but I can put a little bit more weight on it, and like do some PT exercises and stuff to start strengthening the muscles again, because I've lost some muscle tone on my right, which is driving me crazy. But hey, my left leg is very strong, and hopefully we'll keep it that way. So yeah, no surgery next week. Again, it's just a little bit of a mind fuck in the sense that I was really looking forward to that being a major step in this process of healing. And so now it's more wait and see, but it's better in the long run to do it this way than to just jump straight to surgery and, risk all the complications that could happen with a surgery like that. So I'm grateful that my surgeon is being conservative about it. And I trust that, what he sees on these scans is nothing short of a miracle at this point. I mean, the ultimate miracle would be that it all goes away, but I don't necessarily know that we need to worry about that right now. So thanks for listening to almost 14 minutes of me kind of going in circles. And yeah, I figure this is the best way to give everybody the same update. So we are going to upload to YouTube now, and hopefully have a nice weekend off of meds for the first time in several months.